Hello everybody, welcome back. Today our topic is history taking. What is the definition of history taking? History taking is the totality of information gathered by the physician from the patient or the persons accompanying him or from the medical papers claiming to establish the diagnosis, prognosis or treatment. So we can gather it from the patient himself, or from the people accompanying him, or from medical papers like the patient file, etc. What is the technique for history taking? The technique is as following. 1 is the physician's experience. 2. Knowing the patient's psychology. 3. Medical information. 4. Amount of time available. 5. Patient's mental status. 6. Adapting the language of the patient so that you will be able to communicate with him. Patient's reliability. Number 7. History taking can be direct way or a mediated way. What's the difference between them and the difficulties in each one of them? We will talk about this now. Difficulties facing the direct history taking is like domination of the subjective symptoms, temporal and spatial non-concordance between the symptoms collected during the history taking, type of complaint. As for the difficulties in the mediated history taking, the data are not emerging from the patient himself, from the direct source. Clinical observation depends on the skills and the interest of the observer. Timing of the observation. 4. Eventually, incomplete medical documents may be available. So this is the difficulties that face the physician in the mediated history taking. What about the information that should be collected during the history taking? First, I'll mention them, then we'll talk about each one of them in details. Let's start with the first one. Personal and preliminary data. 2. The chief complaint. 3. Details of the present illness. 4. Past history, the physiological data. And 5. Past history but pathological data. 6. Family history. 7. Social data. Let's start explaining the personal and preliminary data. What does this part include? First, we can divide this part into 2 parts, Part A and Part B. Part A includes the name, the age of the patient, gender, place of birth, place of living, ethical or racial apprentice, profession and employment history, while Part B includes 1. The date of admission, 2. Date of discharge, 3. The medical leave after discharge, 4. Referral diagnosis, 5. Diagnosis at admission, 24 hours, 48 hours or 72 hours. Diagnosis at discharge when the patient is discharged out of the hospital. Patient status at discharge. So these were the 2 parts of the personal and preliminary data, Part A and Part B. Let's talk about the second one, which is the chief complaint, the reason for the admission. A list in this part of the history taking, there's a list of symptoms and or signs that the physician considers to be the most relevant. From the patient, what are the symptoms and or signs that the patient tells you about? Note that no diagnostics in this part. Now let's talk about the present illness, in terms of the present illness itself and the past history of the present illness. Present illness must obtain description of all the symptoms and signs, their evolution, pharmacologic treatment and dosing, paraclinical investigations, medical consultations, 6. Accomplishments of medical recommendations by the patient, and 7. The relationship between the symptoms and the medical guess of the patient. Note that previous established diagnosis can be used for present illness. What about the history of the present illness? The history of present illness, this part of history taking, is a general description of the principal moments of patient's illness from its start until the moment when the immediate symptoms occur. Note that the previous diagnosis can be used. Such history can be missed.